So if you're going to be on screen, you have to take a break every 20 minutes.
You hear that, Mia? So coming from a real eye doctor, she's telling you this face to face.
Is there a doctor in the house?
Welcome back to another episode of Facts of Life, the #1 podcast in Brunei. I'm your host, Zed Peace.
I'm your co-host, Chaos.
And right now it's episode 13. We have here Dr. Helena Hurairah, ophthalmologist or eye surgeon.
Oh, you got it right.
I'm Helena. I'm a children's eye surgeon based in Ripas Hospital. I also see adults, but after completing my training in the UK, I also did some extra training to train in pediatric ophthalmology. So although I see both, I also see children because children's eye health is one thing that I'm very, very passionate about.
Can we just go straight into it? What made you go into this field?
Oh, wow. Just straight
into
into a job interview.
Why eyesight?
Why eyes? Okay. Actually, so my mum used to work in the ophthalmology department in Ripas when I was growing up.
Okay.
And she was like, you should be an ophthalmologist. She wasn't an ophthalmologist. She was an orthoptist.
Oh.
And they check eye movements. And she did a whole lot of other stuff as well. And she's like, yeah, you should be an eye surgeon. So obviously mum said you should do this. So I was like, not doing it.
Oh, yes.
Not doing it. Until I graduated. And then in my second year after I'd finished medical school, so I was already working then, I had a placement in ophthalmology.
Is it your choice?
It was part of sort of my rotation.
Okay.
So after you finish medical school, you do something called foundation training. So it's like internships. And I had ophthalmology in my rotation. I was like, oh. And then it's one of those things, I think, if you're meant to do something, your calling, whatever, it comes and finds you. And I really enjoyed it.
Wow.
And I was like, oh no, she was right. I don't want to admit my mom was right. She was right.
But it is an interesting thing.
Yeah.
I mean, sight, it's the main thing, how we view the world, right?
Yeah, exactly.
So
yeah.
It is.
It's
like,
just how we process the world around us. And it's such an interesting mix of medicine and surgery, and the fact that you can change someone's life. The surgery itself, for example, a condition like cataract, where your lens is cloudy and it impairs your quality of life, and the fact that you've got a 20-minute procedure that you can do, and
so it really is fixable.
Yeah.
Cataracts is
one of the main causes of what we call reversible blindness in the world. So
and that is just over time. Cataracts just happen. It's not hereditary or.
So a couple of risk factors: living in Brunei, UV light exposure, diabetes.
These all affect your.
Yeah,
cataract
it all
eyesight.
affects the lens getting progressively cloudy. Steroid use, and that can be anything. For example, if you're a child and you had bad asthma, the steroid inhalers some people have to use. That can speed up the rate. So sometimes I get like 20-year-olds who had like eczema or asthma when they were a kid, and if eczema, they put the topical cream on and stuff, and then they end up developing cataracts early.
Oh, wow.
Babies can have cataracts as well. So we've operated on children as young as like 4 weeks old. So yeah.
What's the most probably the age that
the youngest I've ever, or
the most common age that people will probably
the most
get
common is after 55. Yeah. So generally it's age related, but it does affect like the whole age range of the population.
And do you think is there such thing as perfect vision? So when people say 20/20 vision, and they never wore glasses in their lives, is that considered there is this perfect vision standard?
Well, yes. I mean, I guess for us, what we'd classify as good, excellent vision is what you say 20/20 or 6/6, as we say here, because we use that metric system.
Yeah.
So it's when you look at a chart. So for 2020, it's 20 feet away. For
Oh,
six, it's
is that why it's
6
called
meters away.
2020?
Yeah.
Is that the reason why it's called 2020?
Yeah, so
vision?
we have this chart which we call the Snellen chart, and in Brunei we use it at 6 meters. And then when we get you to
You
read
read,
like
like, one eye
read
closed.
like
Yeah.
E
Yeah.
and D and stuff. So
But is that a really accurate measure of
yes,
our sight?
It's
Okay.
a scientifically
Okay.
scientific measurement system. So that's
Yeah.
what 6 means.
And the whole idea is if you can read the whole chart, that means you're
If you can read the whole chart, like right down to the bottom, you are probably Superman.
so that is not
But 6 is
that
good.
is the, okay.
Yeah, I'd be happy with 6.
Yeah.
Is there any like certain diet that is good for eyesight? I heard like carrot. That would probably
Is that a
good one.
myth though?
No,
Yeah,
a carrot. Well, so
yeah.
carrots have beta carotene, so that's where that comes from. Yesterday, actually, we had our World Sight Day event at RIPAS, and it was one of the things I covered in my opening talk, where I was just talking about good. How we made this comparison where people said, well, how do you look after your eyes?
Yeah.
You just like rub them and whatever. But it's more about, how it's just like we look after our mental health,
Yeah.
with meditation, mindfulness, and journaling. That's sort of self-care practice. It's the same thing with your eyes. There's certain practices you can do to preserve and maintain and improve your eye health. So nutrition
Yeah.
definitely is one of them. So as you said, carrots with beta carotene, and then zinc, lutein, zeaxanthin, vitamin C, vitamin E, all of these things which are good in preventing things like diabetes as well.
Like besides diet, are there any other ways to kind of protect your eyesight?
So not too much screen time.
Yeah, exactly.
Everyone hates it when I say
Yeah.
that. They're like,
But it's true, wouldn't it? Like, wouldn't it be like that is damaging?
It's
like
I mean, the eye strain. I don't know if you've ever been on when you can't draw your eyes away from the screen because you're scrolling through
Yeah.
TikTok or whatever it is,
No.
and
Yeah.
you're lying in bed at night and the lights are off, and you can't stop. There's something about the screen that drags you in.
Yeah, but now they have that they have the night mode, so it's like a bit dimmer.
Yeah.
Do you think
Oh,
that
right.
does
Well, it's-
changes a bit?
It's just the fact you've got something that you're looking at near, so you're close up, so you're already overusing these muscles. You're not blinking. Your blink rate then reduces to probably half or less than what it normally should be. And the blinking is really important. It's like a windshield wiper. So, for example, if you're not, if it's raining and you're not cleaning the screen enough, it just
So blinking is actually
blinking is
like a
protective.
normal-
It's all these kind of really, really subtle gifts, I would say, that we have to protect our eyes. But then when you're doing that, me talking to you, I'm blinking naturally. But when I'm on a screen, I'm doing that.
Yeah.
Oh yeah.
I mean, my earliest, like, I remember coming across Dr. Helena's content before, and like one I was really amazed by was you being on a helicopter and going to these remote locations, and I'm thinking, wow, that's it's them sending a team over to these areas that don't have access to hospitals or anything. And how is that experience like?
I mean, Brunei is lucky they have that service. It's a luxury to have that. So we have the flying medical service here in Brunei. And so you get a team of a GP, pharmacist, nurse, ophthalmologist every couple of months, dental, and they go out to the Malilas, Sukang, really hard to access areas to provide monthly. I think presently they go monthly if it's not flooded.
But these communities, are they based there and they don't actually go out?
So Malilas, there's a longhouse there, and then Sukang as well. So usually what happens is that we'll inform them the week before, so they don't run out of medication. So it's good that we're trying to make sure that healthcare is accessible and equitable.
But is it a big number of what's the
not
size?
huge. It's not a huge number, but it's
probably made up of
significant enough.
few
Yeah.
like, a number of
I think
families.
more importantly is that everyone is getting access to healthcare. I trained in adults, but then I did another year where I trained in children. So that's something I'm seeing a lot of now, is because of COVID. the fact that they've been on their screens, virtual schooling, they weren't going out because natural sunlight is very protective for the eyes, keeping them at that sort of 6/6 vision level. But now I'm getting a lot of children who are what I call short-sighted. So meaning things at afar are blurry.
Yeah.
And, you know, you sometimes see like people, you know, bringing things close to their face to see. So it's that. And, ooh.
Yeah, and speaking of kids, I mean...
Oh, there's a kid here.
we actually wanted to invite Ayana and Mia before they go off swimming to say hi.
Would you like to come on?
You want to come to the front, Mia? Okay, you can go over that side. Well, just sit on the seat. I mean, you can just have a seat and say hi.
Do you want to sit
Ayana,
here?
You guys want to come?
Hi, Mia. And
Hello.
hi, Ayana. Don't...
Yes, can you put the mic close to Mia? So, before the kids go off swimming, again, thanks, Dr. Helena, for coming by. I really appreciate your time.
No problem.
But we want to know more about what she's doing as a doctor, as an ophthalmologist. So, Mia, do you have any
Nice
questions that you wanted to ask?
I already asked.
Okay, any other questions you wanted to ask?
No.
Can I ask you a question?
Yeah.
How long do you spend on your iPad?
Oh, good question, Doc.
I don't know.
How long do you spend on your iPad, my little marmot screamer?
A lot.
A lot.
A lot.
And do you guys think it's good to spend a lot of time on the screen?
Probably not. Yes. You can learn a lot of things.
That's true.
That is true. Do you take lots of breaks? Or do you take breaks when you're on the screen?
No.
Okay. So yes, you can definitely learn a lot. The world that you guys are in is so different to the one I was in.
Yeah.
You can talk. Do you have a question?
No, I just have the answer.
Okay, what's the answer?
But if you're on screens for a long time, it can affect your eyes.
Yes.
I don't know how though.
That's what we were talking about.
Right.
Because I was saying that I am seeing lots of kids now who need glasses because they've been on their screen too much. So if you're going to be on screen, you have to take a break every 20 minutes.
You hear that, Mia? So coming from a real eye doctor, she's telling you this face to face.
So I'm going to share with you something called 20-20-20. After 20 minutes of screen time, you stop and you look far, like something we call 20 feet away. So the door, for example, there, and you count to 20. And then you can go back to your screen.
Yeah.
There you go.
That.
Yeah.
And that will then relax your muscles here. And then you can go back to your screen.
And of course, going
And keep
going
learning.
out and getting natural sunlight is also a good thing.
So that's where you guys are going
20.
Well, now you're going to go out and get some natural sunlight and
Yeah.
go swimming.
Okay, careful.
By the way, I like your shirt, Mia.
You want to turn around and show Dr. Helena what your shirt says?
Oh. Well, it's also black and white, which is what I use to stimulate the children, like newborn vision.
Oh yeah. So tell me more about color. I think that's something I've
Yeah.
always been interested in. Is
Yeah.
like
There's
what-
a really, really interesting video out where someone's done a kind of simulation of what babies see. So in the first 4 weeks, all they see is black and white.
Oh
And then
really?
the colors start to slowly develop, sort of
You mean as babies like start to see, it's black and white and like vision.
initially, yeah. Very sort of muted, kind of sepia, and then, the colors.
okay.
It's because of the light receptors and
Yeah.
the development in the back of the eye. But so when we get premature babies who are born, in Ripas, they've now started this fantastic program where they have these mobile crib,
Like the
the
mobile
hanging,
like
Yeah.
and it's black and white, just to try and get them stimulated because they've come out earlier than they should.
Ah,
So we're trying to develop their vision and
interesting.
stimulate it.
I've seen this like video in YouTube. Like they have this special glasses for colorblind.
Oh, I know.
Yeah, and
I
I
love
was
seeing
like-
those videos.
I mean, is that for real?
Yeah,
Like,
it
so I wonder what is the trick to it? Like, is it the lens or?
I'm not sure what the trick is. It's most common form of color blindness is red-green.
Mm-hmm.
They call it red-green color blindness, and I guess the lenses restore the deficiency of what they're seeing. I should really read up on it.
Yeah.
And then they
Yeah,
can see the
interesting.
world.
Is it
in
something to
colour.
do with like the red and blue? Is it like 2D, the 3D? You know,
I
when
don't
you
think
get
it's so much the stereopsis. I think it's literally what their color perception is
And is it different for each person to person,
in
or
terms of.
like how they view?
You didn't believe it, right? When I told you, was
What
that
did
you? I said like there was a
I
special
would love
glass
to
for
see
colorblind.
if they could simulate like what they currently see and then what they then see of the glasses.
Yeah.
on.
Oh, okay.
That
really,
would be
it like
cool.
Yeah.
they like
No,
Yeah, they
I
start
think
like getting really emotional.
Yeah.
I,
I think-
mean, yeah, I'm
yeah,
sure.
even for the babies, like mama.
because they can finally see.
Yeah.
Oh yeah.
Like,
I think I
it's
saw
pretty
the
interesting. I'm
video.
like, you know.
But I had one. It might be sort of a philosophical question, a bit on eyesight. Do you think there are actually more colors in existence than what humans can see, or has every color been
I think
identified already?
I feel maybe the philosophical question is the shade of red on Chaos's shirt the same shade? Are we seeing the same shade of red?
I see red as well,
But
but
is your red and my red the same?
Oh.
but still falls in the category of red. Would it be?
Yeah.
Again, I don't know. I then
You know, because then it could be like a shade of red, but then it wouldn't be called red.
yeah.
I do have some health question.
Oh, his consultation.
Yeah, because I do get it sometimes. It's something to do with the eye. It's like a flash, right?
Yeah.
So it stays there for a while, and then you start getting this migraine,
Yes.
and I was like, "What is this?" So it's sometimes come and go.
Is that astigmatism?
Is it like
No,
yeah?
that's
Some
a
people
migraine.
yeah, some people do
Yeah.
get it, but
yeah.
what's
So you can get a retinal migraine, or you can get migraine with aura. We say aura. So where you're prone to migraines. Are you prone to migraines or headaches?
yeah.
Yeah.
I can
Yeah.
yeah.
So when you get that, it's kind of a precursor saying, "Oh, I'm going to have a migraine."
Yeah, it's like a flashbang.
Yeah,
Yeah.
yeah.
Like,
So
And
it's
some
like
people
your-
get
it's like-
weird stuff. They get like kaleidoscopes. They get
Oh, yeah.
like,
Oh, yeah,
what is
sparkly
that? Yeah.
things.
Yeah.
So it's all, just the way, I suppose, the signals from the eyes, because the eyes are essentially, it's like a camera, right? So lens, film, which is the retina, and then there's a processing of the image, which
Yeah.
is the brain, the
That's like the
occipital.
that's like the
cortex, yeah.
screen that you see, right?
Yeah, so we get all sorts of, people coming and drawing what they're seeing, and we do a full examination. The eye examination is completely normal, but then so we end up doing an MRI. It's neuro-ophthalmology, so that's the study of the interaction of the eyes and the brain is really, really interesting.
Yeah.
Interesting.
Complex, so.
Yeah, and I wonder how far are we gonna go in terms of eye, like the research that we're doing on
Yeah,
eyes, like to the
yeah.
point, can we make blind people see?
So, very recently, Moorfields in London, where I trained for a while as well, have just inserted a robotic implant.
Never before has a robot been used to operate inside the eye.
Tell us what you've seen in the creative scene so far, like knowing that you create your own content as well. How do you see Brunei's creative industry shaping up at the moment?
I feel that there's a rise in the local talent for sure, and that people are starting to appreciate it now. Whereas before, I wasn't around. I was in Brunei when probably like Mike Bandits
Yeah,
were,
Mike Bandits.
right?
Yeah.
But did you find it was getting that kind of local support, especially from people who didn't really quite get what you were trying to do?
Yeah, and I
difficult?
think that's why there's a debate we had recently with somebody. He was saying, what do you think of the term support local? Is it a good or a bad thing? And of course, anyone would say, of course, that's a good thing. But there's a connotation when it comes to support local that it's almost support local as in it's almost like a pity support. like support local as in just
Is that what you find?
well, it is different people interpret it differently, but
It's like if a product is not good, don't keep supporting it just because it's local.
yeah.
Mm.
We always take it positively. Like when it comes to supporting local and support local, we genuinely are supporting in terms of we actually buy the things that they have
Right.
to offer.
I guess like we don't want to ask people to support us, you know. It's we want them to just, when you feel like you want to support us, then just support us.
Right. So
Right.
it doesn't feel like a pity party.
Yeah,
Yeah.
you don't want to hashtag support local.
Yeah,
when-
support
come on,
local.
Support it because it's
Support
quality.
ZPs.
Support it because it's good.
Yeah, actually, I think that's the nail on the head. I will support anything as long as it's quality.
Yeah.
Yep.
And it's a good service.
Correct.
It's a good product. But if support
Just
support
because.
local means like
Just because.
just
yeah.
because someone hashtagged it with
Yeah.
LOKAL, then
Okay.
I'm not sure,
Yeah.
because I've tried my best to support some services and products, and the customer service is not good.
Yeah.
Yeah.
And it really taints, then, I suppose, that hashtag where
Yeah.
you're trying your best to. I really do. I really, really advocate for trying to keep things as in-house as possible and really
Like give
helping
back- yeah,
people,
give back to the
their
people, yeah.
potential.
Yeah.
But it has to also meet a certain standard.
Yeah, that's,
Definitely.
I mean, there's no way around that. I think being in the creative entertainment industry
Mm-hmm.
for all these years, I mean, yes, there's been a rise of more people doing more things, which
Mm.
is always good. For example, even from this podcast, there's other local podcasts
Yes.
appearing as well, and that's always a good sign. But Facts of Life, we aspire to be the number one podcast in Brunei. But if you want to be the number one podcast in Brunei, by all means, go for it. I think.
I mean, I
healthy
think it's very
competition-
subjective what number one is as well. How
Yeah.
do you, is there a scale where you can,
Well,
grade?
episode numbers. So if you're
Okay.
already
Yeah.
we're 13 episodes in. So if somebody didn't want to catch up, then unless
Yeah.
they really did more than a weekly podcast,
You just need to do, like, if you go to YouTube, just type in like podcast Brunei. So
you can see the
yeah, you see the first video. If it's us, then we're the number one podcast in Brunei. So you guys check it out.
yeah. So
Yeah.
all you have to do is be that. Just be the number one
Yeah,
podcast.
that's
in
it.
Brunei,
Because
and
the
boom.
YouTube won't lie. They have the stats.
yeah,
The views, when,
you
you
can't
know?
argue with numbers. I
Yeah.
suppose.
So when we brought in
Yeah.
Xavier, French guy, that he by just him posting on TikTok,
yeah,
that was our fastest viewed episode
okay,
Yeah.
because he was just sharing it on his platforms. And
yeah,
this, to me, this is the definition of support local. Not people saying it, but actually doing things to, to share content,
Right.
to
Yeah.
collaborate, and all sorts of things. So that
Yeah.
I feel that companies like Progressive are doing a really, big. They're making a
Progressive.
big effort
Yeah.
to support the local
art
creative.
scene and creative
Yeah.
scene.
Oh, yeah,
creative scene,
definitely.
for
Well, I would
sure.
say I'll go a step further to say more companies in general are
Mm-hmm.
willing to collaborate, and if you approach them, they would want to have a sit down and see. I think if you do have something to offer, a product or service, in our case, a platform, then companies will be willing to help out if you. I think if you genuinely show a solid plan that you have and
Right.
what you actually want from them.
Yeah, I feel so. I haven't lived in Brunei. I've only been back for 4 years.
Okay.
So I lived away for 20
Wow.
before I came back.
Ooh.
Yeah. So I left when I was 17. Don't do the math. But then I wasn't here. So this kind of, I suppose, world that I came back to is very, very, very different from when I was in Brunei. This sort of rise of the influencer,
Oh, yeah. The social media.
the
scene.
social,
Yeah.
like how Brunei's embraced it and adopted it is really something I'm still getting used to. And even the kind of local influencers and we were speaking just now about motivational speakers and
Yeah.
things, the whole world as well. I've seen a lot of people going for personal development courses, for example, and there's big kind of trademark names out there, and then they go in a course and then they come back to Brunei and then they're suddenly they want to be a motivational speaker.
Yeah.
And how do you feel about that?
That's the way it's supposed to be. I
Yeah.
think we always get, even me and Chaos, we get inspired by different people and different
Yep.
content as well. Like he'll consume a totally different set of content than what I consume, but we all can sit down and exchange those ideas and eventually try to figure out what can work for us.
Right. Yeah.
So I think when it comes to actually executing projects or thinking about projects, try to find a team, like people that you can bounce ideas off. I think that's a really important process in doing a successful creative venture.
Yep. And also the energy of everyone as well, so we can have like the consistent technique. That's always the best way.
Yeah, because you bear in mind we're working with we're doing this as we're doing this out of our own will, kind of thing.
Right.
No one's
Yeah.
forcing us to do any of this.
Yeah.
We didn't have to set up the lights, the camera, like all
Yeah.
of this, but we feel we want to showcase, we want to
Yes.
collaborate, we want to we want to provide a platform, but more so even throughout this podcast experience, getting the guests in and having that insightful discussion with them on air, and like being able to share that out.
Have some people said no?
I talked about it before, but it's usually not a straight no, or
Someone didn't even reply me.
oh, did you? Okay, well, most of the time they'll reply to me if I ask them, but
Of course.
they'll
Mr.
say
Famous.
coordinating the schedules sometimes is a bit difficult. But we had a guest earlier this week who we had to sit down with him, so we're sitting out with Dr. Helena today. We have a few guests after this as well. So really, how hard is it to find 100 Bruneians to talk to? I think that's the question we want to really pose.
Yeah.
People from all walks of life. So
Yeah.
if
Do
you
you
can
have
reach
any idea of who we should interview next? Do you have any idea?
anyone you're inspired by that you would want to know
Yeah.
more about.
Oh,
Perhaps.
I'll have a brainstorm. Now I don't work well on the spot. I'm like, what?
No, how
There's
about-
There's a lot. That's why I think I'm just interested in how, and maybe it's also the educational initiatives that, for example, embassies and things have invested into Brunei, and you're seeing the product of that
Yeah.
as well.
Ooh.
We've all obviously you've got the U.S. Embassy very strong with YC Lee, and then the British Embassy with their chevening initiatives. So I think it's just more that I'm seeing, having been away and then coming back, and all of that was going on. Coming back into that space and seeing what the youth are doing now is very, very inspiring.
Yeah.
The energy, I don't know. I don't classify myself as youth
No,
anymore.
no.
Would you?
I
What
mean-
do you do? When does youth stop?
apparently 35.
Oh,
Right.
on the cusp.
said,
You're
right?
okay. You're
Yeah,
okay.
I'm 35.
Yeah.
No, but I'm still okay because I'm
Still-
like
okay.
at
I
35.
barely made it. Or
Almost,
still
almost.
there. Okay.
Yeah.
Next year.
I think I felt my age when someone said to me like, "Oh, you're too old to be nominated for this, but we've put you in the mentorship category." I'm like, "Oh,
That's how you know. That's how
I'm
you
a
know.
mentor
Wow.
now."
Oh my goodness. But as in the way I see it, wisdom is something that can only come from age and experience. So like I'm looking forward to being
You want to be a
being
mentor.
told you're a mentor level already.
I want to be a mentor. Am I a mentor level?
I'm
Well,
Shifu. I'm Shifu
Yeah,
level now.
everyone, but that would mean that
Sensei.
you've been there a while. So, but I do see a lot of positive changes, but there are still, of course, the usual challenges we face in terms of how do we really get our locals from here to that target area that they want to reach, that they're aspiring to. And again, as Kaya said, it really is a consistency thing. I think with internet, especially with all the noise that's out, with all the content that's out, how are we supposed to compete? Just be consistent. Just forget the noise and just do you. Like
How do you forget the noise though? So I find societal conditioning a very tricky area for especially the young people here, to navigate.
Can you?
So we are, with any society. No, I'm not saying just Brunei.
Yeah.
When you grow up, you're told how to behave.
So the environment that.
Yeah. So the environment. It's kind of like the system is such that, for example, we've got 2 little girls here, and hi, just an example.
Showered. Well done, Mia.
And they're told that good if you're quiet and obedient, that equals good.
That's the way it
that's
is.
so
Yeah.
right.
Yeah, that's
so and to not cry for a boy is being brave.
Yeah.
So what is that teaching the boy? That tough means that I can't express my emotions.
Yeah.
So as they grow older, what I hear a lot, a big buzzword is like trauma.
Yeah.
Childhood trauma.
It's like the 2020 language.
Yeah, and everyone's woke suddenly. And I feel that when you said you want someone to get from here
to where they're aspiring to be,
they also, yes, there's the noise, but then there's their inner battle with themselves. Say you want to do something unconventional by society standards, then they have their need to face,
so
they
have these additional
parents,
kind of
extra stuff,
pressures,
extra cultural, religious, societal trauma to process. And I think it's something I see a lot of, when I see people do come to me for my mentorship. A lot of it has to do with but my, parents don't want me to do this. And, we all know that ultimately at the end of the day, if you do something not for you, but for someone else, it's never going to make you happy.
Yeah. But do you think it would be a wrong approach to say to them, like, stop making excuses, just go, just do it? Like, is that really a wrong way? Because that's how we kind of push ourselves. Like, chaos. We have an interview today too. Like, by hook or by crook, just come here, and just let's do it. But of course, like, not everyone responds well to that kind of pressure. But if I look at it, the person is trying to get them, to push them to get their dream, go after their dream.
Yeah.
But
for me, as long as you try your best, at the maximum as you can. So if, like, I could probably, didn't come here today, but I just pushed myself. I said I can do it.
But I'm saying, as somebody like somebody telling somebody what to do, like him just saying, stop making excuses. You're making excuses. That's why you're not going anywhere. And is that approach kind of like good or not?
Yeah, I guess, like, in a way, it depends on the situation.
Yeah.
Right? Like, depends on what excuses.
I mean,
and what choices is he picking, or, depends on the whole situation. You have to see that.
True. I mean, I always see there's a lot of tough upbringing, tough love upbringing that goes on around here, and that contributes to the.
Yeah. But it's good. It toughen up a specific individual.
It toughens them up, but it might hold them back from.
Yeah, definitely. So it depends on how they think.
Okay.
I guess, always in a good way.
Okay. Eligible for mentorship or?
I mean, it's not an age thing, right? It's a life experience thing.
Yeah.
Mentorship, right? So I think, my daughter's there.
It's really about this new generation that we're interested in helping out. I mean, people.
So that's your value.
Yeah, I think
giving back, contributing, and paying it forward.
And
that's why you showed up today.
Yes.
Yeah.
Definitely.
And I think that's more, it is knowing yourself and knowing your values. That if you know that clearly, it's Islamically niyat.
Yeah.
Yeah.
Yeah, if your intention is clear and
pure,
no matter what the noise is, no matter how you go.
That's spot on. Actually, when I talked about the noise, perhaps that's what I was referring to.
Yeah.
If you can clear out all that unnecessary kind of.
Yeah. So whatever impact you get,
right,
you're still gonna go move forward.
Yeah.
Welcome back to Facts of Life, the #1 podcast in Brunei.
Your turn.
I've definitely learned a lot from you, Doc. I think when it comes to medicine, like this is our first doctor.
Yeah.
Yeah, Dr. Dre doesn't count. So
He's
Not
a
yet.
doctor.
his name is Doctor, but I think he
A
might.
doctor for music.
Maybe
Yes.
he's a PhD in rap.
Possibly, but having I would say subject matter experts like yourself, people like Roseanne, it just brings a lot of insight to even anyone watching, anyone tuning into the projects. So I mean, I'm really glad, and we really do hope to see more of more of the content that you've been putting out.
I'll probably have to get tips from you guys. It's just
Perhaps.
it's been great being here. I think it's given me a lot of food for thought.
More people taking up ophthalmology.
Yes,
as a
yeah,
profession?
actually, when I came back, there were 2 trainees, so two doctors who are practicing and wanting to train, and now
Did they say you were their inspiration?
no one says that. I don't. No one
Best
says that.
mentor.
Okay, mentor.
I'm just a mentor. But now we have 6
Wow, okay.
since I got back 4 years ago.
Yeah, and I think that's always a positive sign. Even as I say with this podcast, like people are starting to just do it because they are at least trying it out and going into it.
Yeah.
And
I find podcasts are very nice. I guess that's the only word I can think of. Just because you don't have to be you just have to talk and be
Spontaneous.
It's very intelligent. I
Yeah.
think podcasts.
yeah, I think there's a lot of insight to get, especially if the discussion is an intelligent, insightful discussion. But I mean, the best of podcasts are the ones that either bring in a lot of
Good
Angles.
good discussion
information.
perspectives.
Yeah. All the positive things.
Yeah, definitely.
Yeah.
Like when we see the international podcasts that are attended by people like Elon Musk, they get to interview all these big idea people. You can just get a glimpse of how normal they are, and that's what we hope to also be part of. Just because you're a successful celebrity or whichever field, at the end of the day, that human element can be brought out. Like something like a podcast can bring out that human element,
Right.
Yeah.
and that's to me the way to go.
Yeah, and I think definitely I'm sure she won't mind me sharing it, but one of my patient's
Yes,
mother, so the mother of the patient.
I can see some irritation in your eye.
No, I'm not
Definitely.
irritated. I'm just kind of making sure she's not irritating you.
Okay, it's okay. Go ahead.
No, so I think a lot of the reason for me being an ophthalmologist, especially when I'm doing my children's clinic, having kids myself, especially if a child, no one likes having eye drops. So can you imagine a 3-year-old, 4-year-old, and they're screaming, screaming,
they don't wanna
crying,
be there.
kicking. They don't want to be there. And the fact that the patients come in, they've got their kid, the kid's like, I don't want to see it, and that I just
How we can make it easy for them. Right?
Yeah, and I think the fact that I have kids, I know what they're going through, makes it, as you said, it's that human element, and they feel instantly at ease because they know that I don't mind if your child is screaming. I would scream if I was a 3-year-old, and you're holding me down to put drops in.
Yeah.
So I think it just goes back to that thing. It's that everyone has their own thing, whatever image they're portraying, and that's what's great about podcasts is you
get to
can't
bring that out.
filter.
Yeah,
you don't filter
you
your
get to bring that
image.
out.
You don't filter
Yeah.
anything, and then people kind of, as you said, find out that human, normal side of you.
And that's like what we that's what we enjoy the most out of this process.
I have a question though. Like if you have some dry eyes or irritating eyes, you can get those eye drops from the shops. I think IMO stuff like that. Is it advisable to just keep on using that? Because
Yeah. So
is it
eye
bad?
washes,
Yeah.
I wouldn't recommend. So something like IMO. I did like a little content thing on it where I was like, I don't like IMO, like the
Doesn't do
actual eye
anything, right?
washes.
Oh.
But if you having good quality lubricating eye drops, you can get them in Guardian. I prefer things that say preservative free on the vials or on the box, because I know that those are less likely to cause irritation or allergies to the eyes. And there's no issue with using them long term. It's not like you can overdose on lubricating eye drops.
I see.
Yeah.
Okay.
And so I always keep one in my bag, keep one in my car. I'm a big user of eye drops.
And you don't wear glasses or contacts?
I wear contacts.
Oh, you are? Okay.
Yeah.
So you don't have 6/6?
No,
vision
sadly,
anymore.
not since I was 3.
Interesting.
Been wearing glasses since I was very, very young.
So you have a 20/20 vision, right?
I kind of do. I think out of my whole family, I'm the only one without
Okay.
glasses amongst
Yeah.
siblings and my parents. But
Yeah.
I never saw it as a good or a bad thing. Whether you have good eyesight or not,
Yeah.
right?
Yeah, it's just
Yeah.
like my eyes are now.
Okay.
Just glasses is
Yeah.
LASIK. You could always go
Oh,
for laser eye
true.
surgery.
Yeah.
And that's safe. That's actually a safe
Yes,
thing, right?
very safe. Yeah.
Ah.
Again, hopefully, watch this space.
Oh, that bringing it here or something?
I hope in the next coming years.
Okay.
Yeah.
Oh yes, sir.
Yeah, I
wanna
mean,
try that.
so we're reaching the end of the pod, like the
Yeah.
second half. But we just want to wrap things up the few minutes we have. I think besides just showing our appreciation, it really is that ability to inspire others. For example, my daughter always talks about being a doctor, and that's why I'm telling her, like, a doctor is coming to the show, and it's that element of how we can lift each other up just by being there, just by being just saying a few words to each other. But I want to see. I do want to see a positive effect come out from all of this. I think there's always a benefit when people try to share goodness, try to share good content, and I truly believe that that's the direction people are going nowadays, especially.
Yeah, I would agree with that, and I would agree with your previous comments just now, just in terms of how, even if we don't see it, everyone's interconnected in some shape or form, particularly in Brunei, this sort of 6 degrees of separation. It doesn't apply here. It's
Like
kind of one or
everyone
two.
knows. Yeah, everyone's like literally related to each
Right,
other.
exactly.
Yeah.
I think we found some links already
Yeah,
just now.
Wanna
Well, for me, the word doctor itself is already a very big word. For me, an eye doctor, I mean, even for me, I face something to do with my right eye. There was this gray vision that couldn't go away. So when they did the sound wave, is it? To see, there was like a little lump. Like I think it's like there was the veins popped or something. But
Oh, really?
so, but they didn't know, so they need to go for a further checkup, and they injected like a yellow ink.
Yeah, the yellow.
So I think I was
dye.
like, but I was like the Simpsons.
you were yellow.
Yeah, I felt
then
like
they
yellow.
took
My skin felt
photos.
yellow. I don't know. Yeah.
So what did they find?
They said it's not. It's normal. There's nothing that popped. I mean, that's what they said. It's nothing serious. They asked me just to get this type of eye drop, but sadly, the hospital they couldn't provide it. They were out of stock. I think due to COVID as well.
Oh, this is quite recent then.
Yeah.
Was it?
Actually, like maybe a year, 2 years ago.
Oh, wow.
Yeah.
But
So
I
I
mean,
didn't know.
you're-
I got scared. So it's a
Yeah.
fear of. I don't know what fear that is. Like fear of.
Yeah, but I mean, your
Blindness, maybe.
point was the fact that you like a doctor was the one that
Yeah, the
kind of saved
doctor.
your
Yeah,
life.
kind
in
of
a way,
saved
right?
like advice this. So we look upon to doctors very well. So
Yeah.
Yeah, the nobility of the profession and like
yeah, any type of doctors. I'm like
yeah,
generally.
yeah, and it's
Yeah, I think it's an interesting perception. I would say that I would hope that the majority of my colleagues go into the profession with that
yeah.
niyat.
Yeah.
Obviously, there's always outliers to everything. So I would say thank you.
You're welcome.
It's very, but I would also, being someone in the medical profession myself is also, there's accountability on our patients as well. And also to not, I would say it's a two-way thing, we
Between the doctor and the patient.
Yeah. So I'm I'm not a, I would say practitioner who is what we call a paternalistic kind of one, where tell me, I'll diagnose you, and now I'm going to tell you what to do. It's kind of like, for me, my approach to patient care is, okay, tell me what's going on. How can I help you? And then let's discuss also at the same time how you feel you can help yourself.
Yeah.
That's important.
Kind of like what you do in a way, right? Yes?
Definitely.
Right. I think there's always, when it comes to people sharing things like their work experience and what they've learned from their career, it always comes full circle. I think that's a facts of life.
Facts of
That's a
life.
facts of life. Are we all going to share one facts of life?
Well, we could. I mean, do you have? Any
Yeah, we
extra?
have it throughout the yeah.
What's your? I'm going to be the podcast host.
So what do you want to know?
What is your?
My number one facts of life is staying in order. Wait, I had a line. Be the most Wait. Right, I forget it, but it has something to do with positivity, and I truly believe that. Once you exert positivity, positivity will.
Right.
Yeah,
So once
get
you
back
look at
to
the
you.
world through a positive lens,
Yeah.
then all you get back is,
And I do.
it's that whole blessing lesson kind of.
Yeah.
Oh my god.
Silver lining.
I was so scared,
What?
but I was so scared. My vision. It
Oh, that time when it happened.
Yeah.
I remember it.
But I learned something from it.
Yeah.
It's just to be grateful. Take care of your health, everything.
Of course.
Yeah. So that's for me. Also apply to yourself that if you want to avoid those kind of things, just try your best to avoid it. Yeah. But if you already tried your best, but it still, hits you, just it could be something else. Just saying.
And that's the facts of life.
Facts of life.
But Dr. Helena, really thanks a lot for dropping by, and really we do wish you all the best.
Thank you.
And
Always
keep supporting. So not just support with the inverted commas.
Local.
Support, really.
Support local.
Yeah. Support what everyone here has to offer, especially if it's quality content and all that. Don't forget to subscribe, like, and share. Facts of Life, the number one podcast in Brunei. Catch you guys next week. Holla.
Peace.
Bye-bye.